Okay, great. Thank you. And first, I'd like to thank Morgan and the team, as well as everyone for putting this together. I also want to thank all the attendees for joining us today, because this is really important. What we're going to talk about is, we know, I think everyone on here has been watching the news, and we know that the coronavirus, obviously had two big waves here in the Houston area, and we are in a good position today. The number of vaccinated persons continues to rise ever so slightly. The number of people being admitted to hospitals continues to go down. However, it needs to go down more. We're still seeing in the Texas Medical Center, we're still seeing, or at least within Harris County, we're still seeing about 30 people per day who are getting admitted to local area hospitals. And we still tend to have about a 9% death rate of people who get hospitalized. So and it used to be higher than that, it used to be almost 15%, but the hospitals have done a lot. We've learned a lot about the virus, and we're now more effective in treating it. But nevertheless, for people who get hospitalized, it's been for a long time with about 10% death rate. It's now down a little bit from that. It's down to about a 9% death rate. So even when 50 people get admitted to a hospital in a day, maybe 5 of them are going to die, and this is on a daily basis. And so the situation remains really, really serious, even though the numbers have improved. Now, as we go forward, one of the things that I want us to draw our attention to is the Delta variant that we're seeing talked about around the globe. And there was a lot of talk about its impact in England. And the important thing to learn from England, where the Public Health Service of England actually does a really tremendous job, is they learned a couple of very important things. Number one is the virus, the Delta variant. They've been able to measure that it is, in fact, significantly more easily spread from one person to another. We talk about an R value. And the R value basically is for every one person who's infected, how many more people can you expect that to become infected by that person? And so with the seasonal flu, the R value is about 1.1. We all know how much the seasonal flu spreads on a regular year. The initial Wuhan variant had a value of about 2. And so that spread much more easily than the flu. And hence we saw many more cases. The UK variant was in the neighborhood of 2.5 to 3 because it spread more easily. This Delta variant, the current estimate is that it has an R value of 6, which means it has spread much, much more easily than even the UK variant. Now here locally, the UK variant is still the predominant variant that is spreading among Houstonians. It remains the predominant virus that is being detected in people that are admitted to hospitals. That having been said, we do know that the Delta variant is here in Houston. We've measured it in the wastewater. We've actually had a few patients that have it that have been admitted to hospitals. The number remains low, but we do not need to rest on our laurels with that. We need to pay attention to the fact of what's going on, what we saw go on in England, and what is actually going on in Missouri right now. And it's made national news just this morning, is that in southwestern Missouri, the number of people who are becoming infected and going to local hospitals has skyrocketed, and it is almost entirely the Delta variant. And this just goes to how much more easily spread it is. Also in Missouri, we've got and unfortunately, a very low vaccination rate in that part of Missouri. So here in Houston, we're looking at, we know that variant is here. Right now, it is not taking over, but we have to expect that it will, like it has pretty much everywhere else that it has been. And we need to anticipate that's going to happen. Now, a couple of things with the vaccine. The vaccine, with people who are fully vaccinated, the vaccine does appear to be protective against the Delta variant. We get this from the good work that was done in England. Now, for people who are vaccinated, the efficacy against the UK variant, the one that we currently have mostly here in Houston, is very, very good. It's in the 90+% range. What they found in England, for those folks who are fully vaccinated, their protection against the Delta variant dropped to about 70%. Now let's keep in mind, a 70% protection or efficacy rate for any vaccine is generally considered to be very, very good. The 90% that we've been hearing about is just really terrific. So 70% is still good, but it's much less. Now, here's the other important thing they found in England is that, you may remember in England, there was pretty good protection offered by the first dose of vaccine, and they wanted to get as many people vaccinated as they could. So they made a national policy shift where they, instead of pushing to get the second dose on in 3 weeks with the Pfizer and 4 weeks with Moderna, and they were using predominantly Pfizer, they extended that so that they could use more doses to give more people their first dose. So what they have in England is a lot of people have only got the first dose. What they're finding is it's only about one dose of Pfizer is only about 30% protective against the Delta variant. And in order to get to 70%, you actually have to have that second dose. So here in Houston, my fear is that the Delta variant, it's here, it's going to do what it has done everywhere else. We have a very large population of people who are unvaccinated. And again, for those people who are vaccinated, fully vaccinated, even in England, the fully vaccinated folks are doing quite well in terms of being protected against severe illness and hospitalization against the Delta variant. Those people who are partially or not vaccinated are actually having a much more difficult time. And we're now seeing that here in the United States as close as Missouri. And so I think that as things move forward, we can anticipate that that could potentially happen here in Houston. Therefore, we need to do everything we can to get folks vaccinated. And we also know that there's a lot of vaccine hesitancy. And one thing that people have been saying is that, well, I'll get vaccinated when my doctor tells me or my clinic tells me that it's okay. There's a lot of hesitancy, but they trust their doctors, they trust the clinics that they routinely go to. So a lot of trust factor there. They don't trust the government and they don't trust, public health. And that's, it's disappointing, and but that's the reality. And so we need to all together come as a team and do what we can to protect our community. With that, I'll give it back to you, Morgan.
Thank you so much, Dr. Peirce. And hopefully we'll have time to have folks have you back to answer a few questions if we receive them. But just a reminder, we are taking your questions. If you see your chat box on your screen, if you don't see it, you can try to find it. And as time permits at the end, we will send your questions to our awesome COVID-19 expert. And up next is Dr. Deborah Banerjee, who is our Bureau Chief of Planning and Evaluation.
Thank you, Morgan. I want to speak a little bit about our vaccine access and equity initiative. So this is something that Houston Health Department is very, very committed to. In fact, access and equity has been sort of the cornerstone, that for all of our COVID-19 activities and interventions. As I said, we have prioritized access and equity throughout the pandemic. And the way we are describing access is not only geographic proximity, but also being able to minimize the barriers that a lot of communities face in getting to a site or in finding out about a site. Some of those barriers can be language or other cultural factors, or even trust or mistrust, rather. The equity concept, we define that as an enhanced focus on serving marginalized or underserved populations in terms of race, ethnicity. It could be poverty status, residing in underserved neighborhoods, disability, linguistic isolation, employment or unemployment, and environmental pollution. So these are all the factors that play a role in affecting an individual's health, and also are very much in play when we talk about equity in serving our population. So what Houston Health Department has been doing is we are using geography to explore social and spatial inequality and inform our public health response and interventions. So we have been using GIS mapping and GIS analysis to inform us about conditions on the ground and thereby inform our public health response and interventions. As far as vaccines are concerned, what we have done is we use a vulnerability index. This is called the COVID Community Vulnerability Index, CCVI for short. And we calculate this for each zip code in the city. So we have an idea what each zip code in the city, what its score is, vulnerability index score is, and thereby we can prioritize certain zip codes in terms of a higher vulnerability and therefore requiring additional actions or additional interventions. So this COVID Community Vulnerability Index, just a little bit of information about that. It is an adaptation of the Social Vulnerability Index, which was developed by CDC many years ago, and is typically used for disaster preparedness. It's typically used in the disaster preparedness field to target social and public health interventions. So how CCVI adds to this original index from CDC is it also includes individuals' pre-existing conditions, higher population density, and healthcare system capacities. So these are other additional domains that are included in the CCVI index, and therefore this makes it more appropriate for the situation that we're in, the pandemic situation that we're in right now. Okay, so this gives a little bit of information on what is going on in the city right now. So what we're seeing is about 52.6% of our population in City of Houston is fully vaccinated. So really, this data is as of last week when it was last downloaded from the state, and this shows 52.6. So it's probably a little bit more than that now, but this is what our vaccination numbers are in the city. And if you look at the fourth chart, the one on the bottom right, 90.3% of 60 years and over population are fully vaccinated. So clearly we're doing well with in terms of vaccination with the older age group. However, if we look at our general population, the aggregate numbers show it's around 53%. And so this kind of gives us an idea what percentage of our population is protected by or has a high degree of protection by the vaccination. Next slide. What we have done in the Houston Health Department is we have, as I mentioned earlier, we calculated the CCVI scores for every single zip code, and we were able to take the sort of the top 50% of the zip codes and call those our priority zip codes. So these are the ones that had the highest CCVI scores. Morgan, I think the slide has gone. Yeah, so these are the ones that had the highest CCVI scores, and we called these groups of zip codes Tier 1 and Tier 2. And what this slide shows is a comparison of the fully vaccinated proportion of fully vaccinated populations in our Tier 1 zip codes and Tier 2 zip codes, which are the highest vulnerability zip codes, compared to the rest of the city, the ones that are not classified as high vulnerability zip codes. So if you look at these numbers, I would like you to take a look at the charts in towards the bottom of the page. If you look at these Tier 1 zip codes, percentage fully vaccinated is 33.6%. Tier 2 zip code, percent fully vaccinated is 35.5. And if you go to the non-tiered zip code, the fully vaccinated number is more like 55%, 54.4%. So you can clearly see the disparity in terms of the proportion of people that are fully vaccinated in the city of Houston, and how certain areas of the city, which we identified as higher vulnerability, higher vulnerability population areas, have much lower vaccination rates compared to the rest of the city. So this is what we are really focused on. We are focused on wanting to get these numbers. We want to change these numbers. We want these areas, the vaccination rates in these areas. We want to see them go up. We want to see them much higher than what they are right now, because according to what the numbers show is about 1/3 of the population are fully vaccinated, and therefore have a higher degree of protection from not only COVID, COVID as well as its variants. So what this slide shows is the actual areas of the city where we are focusing our efforts. The zip codes are also marked in these areas. The reason you see the color differential amongst these areas is because for operational purposes, we have divided these areas into 5 zones. The green is zone 1, purple is zone 2, red is zone 3, yellow is zone 5, and blue is zone 4. So this has been done for our internal operational purposes and to sort of organize interventions in contiguous zip codes. So these zip codes have been identified through the CCVI scores, as I mentioned earlier, and on the right side of the slide, you can see the percent of population vaccinated, fully vaccinated in each of those zip codes. And as you can see, for the most part, the numbers are in the 30s and 40s, 30 to 40% vaccinated, which really, which is obviously less than what the rest of the city is, which is at 53, 54%. So, so our efforts are really focused on getting these numbers, to changing these numbers and to see these numbers go up. The most critical issue, as Dr. Peirce has already mentioned, is to keep our community safe from any further outbreaks of COVID-19 or its variants. And again, to wrap up, only 53% of the city of Houston population is vaccinated, and we still have a long way to go.
Well, thank you so much, Dr. Banerjee, for that great description of our access and equity information. And now we're excited to bring our Houston Health Department Director, Stephen Williams.
Good morning. How are y'all doing? I think this is a good segue into both David and Deborah's presentation. I think Deborah did a good job of laying out where we were in terms of vaccination rates. Let me kind of recap what we as a city have been doing in terms of vaccination. And I'm going to be very brief with that because I think all of you are familiar with it. I also sit on the expert vaccination advisory panel for Florida State, and we recognized the fact that initially vaccine was not plentiful at all. It was scarce and the demand was high. And so we in the city of Houston had a strategy that pretty much tried to ensure that vaccine was available in those zip codes that Deborah outlined. Because of the high demand and the fact that we know that we needed to have high vaccine administration rates because we were really a little bit nervous about ensuring that we got our fair share of vaccine from the feds. We went to operating as a hub, and what that means was that we would be a high volume vaccine distributor, and we did that through a variety of ways, both directly and through some affiliates. But we also were able to send vaccine into the vulnerable communities that Deborah outlined. We did that through FQHCs, we used Walgreens, we used Kroger, and some of our affiliates to do that. Now we're in a totally different place, and we all know this, so I'm not going to spend much time on it. Vaccine is pretty much plentiful, and our demand is low. What Deborah has summarized is the fact that in general, our overall vaccine rates, coverage rates within the city of Houston, a little over 50%. But in our high priority zip codes, that number is certainly not where it needs to be. And what the high priority zip codes, as Deborah has pretty much outlined, is those zip codes that have a high COVID vulnerability score. We recognize that in the upcoming months that our effort needs to be intensified, but our ground game actually really needs to be a ground game. We want to engage a variety of vaccine providers and community-based organizations, community advocacy groups, and key stakeholders that have inroads within these communities, within the zip codes that we talked about. We believe that what needs to happen is that what we know from various studies is that people will take the advice of folks that they actually trust. And what we figured out is that through various studies, and not just here in Houston, but that's everywhere, is that it's not about some new relationship that people form. It's about relationships that they've already had. Those are the folks that they're actually going to listen to. And so what we're wanting to do is expand the number of vaccine providers, hoping that people will trust their providers, but also engage various community groups, grassroots groups, so that we can expand access to vaccine. And are going out, and we have actually gone out to clubs, we've gone out to restaurants, we've done door-to-door canvassing, pointing people to vaccine sites that were nearby in their neighborhood, and we made sure that those activities were actually connected. And what we found is that once we have that dialogue and exchange with folks, that there is a good percentage of people that would be open to the vaccine. And so we believe that our long-term game has to be that. There are a lot of myths that are out there regarding the vaccine, and it's only through that dialogue and education that we have seen that people will be more open to, in fact, taking the vaccine. We're hopeful that we will be able to really recruit more providers to come on, as well as grassroots organization and key stakeholders, so that we can, number one, go from the 50-something% to over 70% for the population in the city of Houston overall. But maybe more importantly, in those key zip codes that we talked about, those priority zip codes that we talked about, we're hopeful that we can certainly increase that percentage of uptake in those communities, because those communities are actually vulnerable. Based on the social vulnerability index and also the COVID vulnerability index, we know that those communities are struggling with a lot of other issues. And so therefore, I think it's not only strategic, but it's very important that we enhance our efforts within those various communities. I'll just end there. I know those were general comments, but I'm very interested in any questions and any discussions that we might have around this.
All right, thank you so much, Director Williams. So right now on the screen, you're going to see a link, and we also have it in the chat. how to become a COVID-19 vaccine provider, because that's what this is all about, making sure we have as many people as possible, as many providers as possible that can reach as many people as possible to get them vaccinated against this terrible virus. So we do have a couple of questions. How do I know if I am listed as a vaccine provider for the Houston?
The way you know that you're a COVID-19 provider is that all COVID-19 providers have a 6-digit PIN number. If you are a COVID-only provider, your PIN number is going to start with a 3, or if you are a TVFC and ASN provider, then you keep your same PIN number and it starts with either a 06 or a 25. And also the primary vaccine coordinator and the secondary vaccine coordinator has access to the vaccine allocation and ordering system, which we call VAOS, and that system allows you to place orders in the system to DSHS.
Thank you so much. We actually have another question, and this is, and maybe several of y'all can answer it, and that is, what are some issues vaccine providers are experiencing? So maybe what are some of the obstacles, and maybe even some of the high things about being a vaccine provider?
One of the issues was getting access to vaccines, but now every provider should now have access to vaccines and be able to receive whatever orders they replace in the VAO system. But right now, I would say low vaccine uptake is a common issue during this time.
And this is Stephen. I talked earlier about some of the myths that are actually out there regarding the COVID, which results in vaccine hesitancy. I think that it's important for us to dispel a lot of those myths. And just my going out to various sites and having dialogue with people. I'll give you a couple of examples. Some people believe that if they've had COVID, that they don't need to take the vaccine. We know that is not the case. We know antibodies last around 90 days or so, and that the vaccine is far more effective. I've had people tell me, I am healthy. I don't need to take the COVID vaccine. We know that you're not immune to COVID if you're in fact healthy or in good shape. I've had one situation, somebody told me that they were fine, that their remedy for not getting COVID was taking cod liver oil and flaxseed. That is not the case.
All right, we have another question, and that is, do people who live in the Tier 1 and Tier 2 zip codes have close places that they can get vaccinated? I believe what they're asking is, are there already a lot of vaccine providers in these zip codes?
So we do have some COVID providers in those zip codes, and we also have community clinics that go out to those zip codes to vaccinate people in those areas. So HHD has a strike team who goes out into these priority zip codes to vaccinate people there. So we can send you a list of that. If you all want to provide your email address, we can send a list of those places where we will be holding those vaccination clinics.
I think part of the key to uptake in those zip codes is, education and outreach efforts. We've seen that people that are even closer to clinics don't necessarily access clinics. And so that's why we're counting on being able to engage people within those individual neighborhoods and communities to help us get a higher uptake of vaccine.